Dr. Ruiz from California for questions.
Thank you again for being here, Major General Friedrichs. In the wake of the COVID-19 pandemic, Congress came together in a bipartisan fashion to develop the concept of your office, which was ultimately established through the Democrats' Consolidated Appropriations Act of 2023. Since its launch last July, OPPR has worked tirelessly on the mission of forward-looking work to prepare for future pandemics, the very work I've long called for in this select subcommittee. With so many competing priorities, why is it so important that we continue to keep our eye on the ball when it comes to future pandemic preparedness?
Thank you very much, Ranking Member Ruiz. And I'd say start with the complexity of the threat. It's important that we do this because the threat space is changing. The COVID pandemic, like the 19 influenza pandemic, was a global event, and those will continue to occur as they have throughout the history of mankind. And there are other biological events like measles outbreaks that continue to challenge public health systems. But in addition to that, as laid out in the National Biodefense Strategy, we also have to consider accidental and other biological threats. And integrating those preparedness and response efforts is how we will ensure that we're best prepared for whatever the source of the next pandemic may be.
Thank you. And during recent bipartisan meetings with international pandemic preparedness officials and experts, I asked how lessons learned from the COVID-19 are being applied to the work of preparing for future public health threats. So, Major General Friedrichs, I'd like to ask you the same question. What key lessons that you've learned are you applying from the COVID-19 pandemic to strengthening our whole of government pandemic preparedness and response?
Thank you. And I think the most important lesson, and both of you have touched on it in your opening comments, is the need for further integration and optimizing how we work across what you described as the stovepipes that are inevitable in large organizations and around the world. Each country is a sovereign nation, and we have to continue to work on building the infrastructure that allows us to rapidly share information when an outbreak is occurring, and then identify what the options are available at that moment in time to mitigate the risk related to that outbreak. Within the federal government, we've seen a real appetite and support for working on collecting lessons observed, and I won't say lessons learned yet, but lessons observed over the last 4 years, integrating them into a report that lays out what we've learned, and then using that to update our plans. I think that planning effort really gets to the crux of your question, which is how do we capture an updated playbook that lays out what we will do next time? How do we do this better? These are inherently global, inherently complex, and inherently lethal and expensive whole-of-society, whole-of-globe efforts. The most effective responses are ones that acknowledge that early in the response and then work across all of the levers of government at every level and with industry and other key stakeholders to both begin the response effort and then to adjust it as we learn more about the outbreak.
You know, we also discussed the kinds of reforms we wished we saw during COVID-19 that we should continue to work toward as part of our future pandemic preparedness. Improvements like greater transparency in the wake of emerging threats, stronger supply chains domestically and in partnership with our allies, and more nimble collaboration with local and private sector partners as part of our on-the-ground response. So as we look to future pandemic preparedness, what improvements do you hope to see in our federal response to novel viruses and public health threats?
Thank you very much. And the most immediate one is that we are deliberately and recurrently meeting with state, local, tribal, community, and other leaders across the country to both hear their advice on where they think improvements are needed and then to give them insight into what we are working on, learning, planning, and proposing. And that collaboration has been incredibly well received. Last week, we met with the state and tribal health officers as well as chief health officers from some of the largest cities in the United States. And there was overwhelmingly positive feedback for having the White House involved in those discussions and for the effort to integrate across federal departments and agencies. So we see a real opportunity, as directed by Congress in the enabling legislation, to continue.
So I know it's early and you're in the investigative phase, but what is emerging as a high priority recommendation that can have the biggest impact in our preparedness for the next pandemic through your discussions? I know it might change, you know, with the final report after you get more of the data and collective sources, but as of right now, what are you seeing as, you know, one of the most important things we could start doing?
Thank you. It's what you and Chairman Wenstrup highlighted. It's that collaboration across silos, and it's the respectful, collaborative, collegial, professional interactions that have to happen so that we can provide advice to inform the decisions that Americans make.
So communications and working together. And so what are some of the successes from the COVID-19 response that we should replicate?
I think as we look back over the past 4 years, one of the real successes was our ability to rapidly produce safe and effective therapeutics, diagnostics, and vaccines, and that leveraged a whole-of-government approach with DoD contracting, HHS expertise, and many other key stakeholders across the country. And we should also acknowledge that we were fortunate that we had 20 years of research on the SARS-CoV virus and more than 10 years of research on the mRNA delivery platform that allowed us to move as quickly as we did. So we can't count on that happening again.
And the type of vaccine, the mRNA, had implications on how fast you were able to develop the vaccine. Is that correct? Or
Congressman, that's correct. And to kind of wind the clock back to when we were in the spring of 2020 looking at options, part of what this government did very wisely was to look at multiple delivery platforms. And as many of you are aware, there are different ways that vaccines can be produced, different ways that therapeutics can be produced. And each future pandemic is going to be different. So I want to highlight that as a best practice, that if you bet on only one horse and something happens, then you've got nothing. You're going to have to bet across the spectrum of capabilities that exist today and keep improving those capabilities for future events.
so I have one more question. What's on the agenda for 2024 for your office, and when can we expect to see the report?
Thank you. So the first thing is completing that report, and I commit with the best faith and almost 38 years of service to get that as quickly as possible with the constraints that I mentioned earlier.
This year?
Yes, sir.
Okay.
We will get that this year. The second thing is updating federal plans. And again, I think that's incredibly important that we don't just write a report that sits on a shelf, but we leverage what we captured in that report and use that to update federal plans, which then state, tribal, local, and other officials can use to update their plans. Third one that's very important also that I mentioned in my opening comments is providing advice on the budget. Based on those lessons learned and that planning effort, how do we continue to provide the best recommendations to the President on what should be in future budgets to enhance our preparedness? And then finally, it's leveraging that fall and winter respiratory season, which we have on good authority is going to start in about 6 months. October happens about the same time every year. And knowing that, we should be able to plan for that and identify what we're going to do differently in this next fall-winter season to continue to improve the options that we offer the American public to reduce the risk to themselves, their families, and their coworkers.
Thank you. I yield back.